Hi there. Today I'm going to be talking to you about infection and periventricular leukomalacia. Infection, when we talk about that, means either mom's infection or even the newborn's infection after he or she is born prematurely. Let's talk about mom first. If mom is infected in some way, then what ends up happening is the body has an inflammatory response. That inflammation will cause a release of something called cytokines. Cytokines are not good for a newborn. They will invade the newborn's bloodstream and eventually get into the newborn's brain. Cytokines will cause a reaction which essentially kills off brain tissue. Most importantly, what it does is it kills off white matter in the brain. White matter is sort of the wiring system that we have in all of our brains. Without a healthy white matter, there will be movement disorders. That's why we see a lot of kids who have periventricular leukomalacia have cerebral palsy of some sort or to some degree. Therefore, it's extremely important for physicians and nurses to identify any type of maternal infection before the baby is actually born and treat it. Infections such as gallbladder infection or a sepsis or even chorioamnionitis are extremely important for IV antibiotics to begin and get the treatment for that infection completed as soon as possible. At some point, the baby will be born, and if the baby is born prematurely, then the baby's brain is vulnerable for any type of damage. That damage can cause periventricular leukomalacia and a host of other symptoms due to it. So it's extremely important that if the baby gets infected after being born prematurely, that the baby is also treated for that infection as soon as possible. If you have questions about whether or not your baby was infected either by mom or by itself after it was born prematurely and it led to periventricular leukomalacia, then you need to speak to a birth injury lawyer. My name is Adam Funk, and I am a birth injury lawyer.